Hi there, I'm Dr. Don Findlay at Chiropractical. This video is made to help you to hopefully help yourself with your headache pain. In this video, I'm only addressing tension type headaches and cervicogenic headaches, or headaches with their root cause in the neck. Now, as with most of my videos, I'm packing a lot of information into a very short time frame here, and the idea is that you're going to just rewatch certain sections as you need to. So the first method of self-care I'm going to talk about are ways to loosen up tight muscles in the back of the neck that anchor up into the base of the skull. Then we're briefly going to discuss ways to strengthen the neck muscles to try and help prevent headaches in the first place. And we'll end with a few different tricks that work for some people as well. So let's get started here with neck stretches. And you need to understand that stretches need to be done daily. It's the repetition over time that's going to make the difference, not how much we can cram into a day or two or a week. So first, what I want you to do here is just lightly shrug your shoulders down. This will prevent the tendency to raise the shoulder up when stretching, especially if the muscles are sore. So first here, you're going to tilt your head straight to the side. You're going to feel a pull on the side of your neck. Next, you're going to look back over your shoulder as far as you can. And then lastly, you're going to look back and up over your shoulder as high as you can. Now, when you do this at home, you want to hold each position for 10 seconds. And again, you want to repeat this daily because it's the repetition that's going to make the difference. Now, to stretch the muscles at the base of the skull at the back, we want to perform and hold a chin tuck movement, and we want to hold this for 10 seconds as well. To increase the stretch, you can use your hands to tilt the head forward even further. To stretch the muscles below this, so below the base of the skull in the back, I like to use my hands to increase the tension in the muscles rather than pulling the head down and forward. And that's because it's this down and forward posture that usually perpetuates this problem here in the first place. So to do this, you want to place your hands on the back of the neck in the little divots, and you want to start lower on the neck, and now you want to sink your fingers into the muscle, and you want to twist your wrist, pushing your fingers upwards along the length of the muscle to create a tension in there. Here, at the same time now, you want to perform a stretch by tucking your chin down and forward and slightly to the side, away from the side you're pushing your fingers into in the back. And again, you want to do this once a day. For jaw tension and tight muscles can also cause headaches, especially if you clench your teeth at night or you grind them. So here, we want to massage the temples, and we want to loosen up the muscles below that as well. So we have a bony ridge here in the face, and you want to put pressure in just above that and push in and up as you slowly open your mouth. And then you also want to push in and down as you slowly open your mouth as well. We can also massage the suboccipital muscles at the base of the skull at the back. And here you want to place your thumbs about an inch below the base of the skull. And first you want to sink your thumb in, then you want to push up with moderate pressure, and then you want to work across the base of your skull. I find usually tucking your chin down and forward a bit, getting a bit of a stretch in there at the same time helps as well. You can reverse that by pushing your thumb in and now pushing down and doing the same type of movement. And then we can also work across the muscles as well. So again, sink your thumb in and then push your thumb across, and you'll feel like you kind of have to turn the back of your head into your thumb as you do this as well. And if your muscles are tender there, you should definitely be able to feel it. Now, when rehabilitating most things, the first step is to loosen them up. We want to create flexibility, and then we want to strengthen it afterwards. If you don't strengthen it, the problem's going to return very soon. So here's a few exercises that will help strengthen your neck. First, we have a simple over-the-head press. The second exercise is a lateral raise. Now with these, we want to do 4 sets, and we want to do groups of 15 repetitions. And lastly, we have Supermans. Here we want to do 10 repetitions, but hold each of these for 10 seconds. And you want to do all 3 of these 3 times per week. Rehabilitating your neck muscles will help out with headaches, but it does take time. It takes time to strengthen these muscles. So in the meantime, here's some other tips that can hopefully give you some quicker relief as well. So the first tip is to try putting ice up on the back part of your occiput area, which is the base of the skull at the back here, and as well the mid part of the back of your neck here also. We want to put the ice pack on for about 10 minutes and then remove it for 10 and then reapply for 10 until you've iced the back of your neck or the base of your skull 3 times. The biggest rule here is just don't give yourself frostbite. Some people also find relief with sinus pressure points. So with these, you want to press with a firm pressure, and we want to hold each point for 30 seconds. You want to press here, up under this bony ridge, and then up underneath this bony ridge up here as well. Others have also found relief with acupressure points. Again, we want to hold this with a firm pressure for 30 seconds, and you want to press in the web of the thumb on both sides, one at a time. Dehydration and hypoglycemia are two of the most common causes of headaches as well. So be sure to drink lots of water and make sure you get some good food in you as well. A natural remedy trick that can help is to have a glass of water and then add to it 1 squeezed lemon and 1 teaspoon of Himalayan salt. Now, if it works, who cares, right? It might be worth it. With hydration, be sure to be careful with coffee and sodas. The caffeine and the sugar in these can also give people headaches in the first place, and people who usually consume these products as well, if you're cutting back or you just haven't had a pop or a coffee today, you can also go through caffeine and sugar withdrawal, which can also cause and trigger headaches as well. Now, speaking of drug withdrawal, if you regularly consume pain medications such as your Tylenols and your Advils, ibuprofens for headaches, then you can also suffer from something called rebound headaches. Here, as the pain drugs wear off, the withdrawal itself is what is causing the headache. But quite often the person believes the drug has just worn off and the headache is still there, so they take more drugs, and then the cycle just repeats. So just be careful if you're using pain pills. Now, of course, rather than treating headaches and neck pain, if we can prevent it in the first place, that would be ideal. So here, be sure that your workstation at work is set up properly. The monitor is up in front of your face, so we end up with less of this pokey out forward head posture. And good posture is also important at nighttime as well, especially if you find that you're waking up with headaches or neck pain. So during the night, try rolling a towel up and placing it behind the neck to help support the proper curve in the spine. Side sleepers, you should have a pillow that fits between the edge of the shoulder and the head. That way your head isn't cocked over one side or the shoulder isn't pumped up with the arm behind here. Now this can be done by using a properly sized and fitted pillow, or you can use 2 smaller pillows, or you can fold, say, a good down pillow in half. We just want to try to keep close to that space. If you have a headache as well while you're watching this, be sure to try some of the quicker remedies, but be sure to look at the long-term approach as well, because it's far better ultimately that if we can try to correct the neck pain and the cause of the headaches rather than just repeating the cycle over and over. Best of luck.